Good morning students, how are you? I hope you are doing fine. Today we will be discussing about the electrocardiogram. Now what is ECG or electrocardiogram? It is the graphical representation of electrical activity of heart during the depolarization and repolarization in the myocardium, and it can be recorded by electrocardiograph machine by placing suitable electrode on the surface of the body. Now, what is the principle of ECG? ECG is based on cardiac action potential and cardiac conduction. Cardiac impulse transmit through the heart, spread around surrounding tissue and finally reaches the skin of the body. And this impulse in the skin is received by placing suitable electrodes and processed to produce an ECG. Now, why we do ECG? Because it gives information about rate and rhythm of the heart, and it can be used as diagnostic tool for ischemic heart disease, myocardial infarction, arrhythmias and electrolyte imbalance. This picture is showing ECG. Here there are some waves and segments. First of all, the P wave, which indicates atrial depolarization. Then PQ interval, during which the impulse transmit from AV node through AV node. Then QRS complex, which indicates ventricular depolarization, and ST segment, which is an isoelectric line during which the ventricles are completely depolarized. This line is isoelectric because during this phase no electrical activity is going on in the heart. Then the T wave, which indicates ventricular repolarization. The QT interval indicates or include both ventricular depolarization and ventricular repolarization. The right sided picture showing a point known as J point. This point has a clinical significance. This point can be elevated, that known as ST segment elevation in some cardiac conditions. There are 12 ECG leads, lead 1, lead 2, lead 3. These 3 leads are called bipolar limb lead, lead AVR, that means augmented ventricular right arm or augmented voltage right arm, AVL, augmented voltage left arm or left foot, augmented voltage left arm, and AVF, that means augmented voltage left foot. And 6 precordial or chest leads, that is V1, V2, V3, V4, V5 and V6. Lead 1, lead 2 and lead 3 and augmented unipolar limb leads record electrical activity of the heart in frontal plane, and chest leads record the electrical activity of the heart along the horizontal plane. Now this is Interven's triangle, which was named after Dr. Interven's. Here lead 1, in case of lead 1, right arm is the reference electrode and left arm is the exploring electrode. And lead 2, in lead 2 the right arm has negative electrode and left leg has positive electrode. In case of lead 3, left arm has negative or reference electrode and left leg has positive or exploring electrode. The right sided picture showing the ECG pattern that is recorded via ECG. Now the augmented unipolar limb lead. In case of AVR, the positive electrode is attached to the right arm and indifferent electrodes are attached to left arm and left foot. In case of AVL, the positive electrode is attached to left arm and indifferent electrodes are attached to right arm and left foot. Lastly, in case of AVF, the positive electrode is attached to left foot and negative electrodes are attached to right arm and left arm. Again, this picture is showing the pattern of ECG or pattern of cardiac activity of the heart that is recorded via this augmented limb leads. Last of all, the precordial lead or chest lead. Here the V1, V2, V3 and V4 are called anterior lead, V5 and V6 are the lateral lead, left lateral leads. In case of this picture is showing the electrical activity of the heart that is recorded via this precordial leads. Now, in summary, we can say that the anterior portion, the electrical activity that occurred in the anterior portion of the heart that can be recorded via lead V1, V2, V3 and V4, Electrical activity in the left lateral portion can be recorded via lead 1, AVL, V5 and V6, and lead 2, 3 and AVF record electrical activity in the inferior portion of the heart, and AVR records electrical activity that occur in the right portion of the heart. Now the ST segment elevation. In previous slide, I have mentioned that the J point has a clinical significance. The elevation of the J point known as ST segment elevation. In this picture, J point has elevated for 4 mm. That means 4 mm ST elevation has been done. This graph is showing ST segment elevation in case of V2, V3, V4, V5 and V6, and this indicates anterolateral MI, because we have known that V2, V3 and V4 indicates electrical activity of the anterior portion of the heart, and V5 and V6 indicate electrical activity that occur in the lateral portion of the heart. That's why this showing anterolateral MI. And now in this picture there is ST segment elevation in case of 2, 3 and AVF, and we know that lead 2, lead 3 and lead AVF show electrical activity in the inferior portion of the heart. That's why the diagnosis is inferior myocardial infarction. Thank you students for your kind attention. Till then, for the next video we will discuss the next topic. Till then, stay safe and goodbye. Assalamu alaikum.